Hi, this is John Adamson with part 2 of our SOAP series. We're going to work on cleaning up your daily documentation. So as you could suspect, our next topic is going to be on the objective portion, or O, of the SOAP note. So what do you want to include in your objective portion to make sure that the insurance company understands that what you're providing is skilled therapy? Well, the first thing we should be providing is, number one, observations. So what kind of things are going on, again, related to your plan of care? So going back to what I said about subjective, don't tell me that the patient looks pleasant today. That might be nice. It might be indicative that the patient's going to respond to your care and be compliant with what you're doing. But really focus on some very specific things. Number one is going to be observation, like I said. So tell me, is the patient walking today with a less antalgic gait? Did the patient get out a full sentence without stuttering today? Did you notice that when the patient came in and they doffed their jacket, they were able to use their shoulder better than you previously saw in a past treatment that you did with the patient? Focus on those things as they relate to your long-term and short-term goals for the patient. Number two, besides observation, is objectivity. Measure, measure, measure. If it's been said, if you don't measure it, you can't treat it. And so we need to have objective measures behind everything that we do. All the chosen interventions that you utilize need to have some kind of objective component behind them. Now, on your daily notes, does that necessarily mean you're going to focus on all the objective testing you took for your evaluation or reevaluation or 10-day progress notes? No, but it does mean that you're going to focus on doing some measurements to help gauge the progress that you're making with the patient. And then lastly, but most importantly perhaps, on a daily basis, especially as different insurers crack down on paying for skilled services, is you're going to focus on the treatment that you rendered for that day. So, what do we want to avoid? Well, number one, we want to avoid descriptors of necessarily just what the patient did. So don't just tell me the patient did 3 sets of 10 repetitions of a particular exercise. That does not necessarily make it skilled, and that patient didn't necessarily need you to do that. They could have possibly done that on their own, or perhaps a restorative aid could have done it, or a CNA could have led them through that. So we wanted to use descriptor words that are action words, action verbs, oriented towards showing what you did and not just what the patient did. So what are some of those words? Well, for example, number one, we could use the word progressed. We want to see progress with their plan of care towards their long-term goals. If it's a static program, it means it's probably not skilled. Number two, modified. And I'm just going to list them off. Adapted, adjusted, inhibited, I already said progressed, modified, analyzed. Things that promote your activity in the treatment that day. You're not a passive participant as the therapist. You are actually doing something with the patient. And that's what you're paid for, to be actively doing things for the patient that nobody else can possibly do. And lastly, what does this help answer? So when you do a good objective section, which includes the observations you make, the objective measurements you might have to take to gauge the effectiveness of your treatment, and finally focusing on the descriptive action verbs that describe what you did for that day, it helps answer the necessity component of care. Remember, we have reasonable and necessary care. This really focuses on the necessity of what you did, and is really what the insurance is paying for. So if you want more description on reasonable and necessary, I advise you to look to those videos. I'll be posting them actually soon to help differentiate between the two terms. But this is what encapsulates what we need in the objective part of our daily documentation. Well, that's it for now. I appreciate you joining me on today's video. Please subscribe to my channel, like the video, leave comments. I'll be happy to answer whatever I can. And most importantly, Go out and get paid for what you do. Thank you.